Hello all, my name is Dr. Sanju Daniel John. I am working as a consultant in the Department of Internal Medicine. I would like to share a topic on dengue fever. So, dengue fever is very common during the June-September months, especially during the rainy season, and it is a mosquito-borne illness. So, dengue fever happens in Kerala most of the time during the rainy season, and we have seen many deaths happening during these rainfall seasons. So during the dry period, the dengue fever cases are less, but when there is rainfall, there are logs of water near the houses, following which the mosquitoes breed and dengue virus infection happens. Now, what are the major symptoms of dengue fever? Dengue fever starts with a high grade fever followed by a back pain, retroorbital pain, that is pain behind the eyes. You will have myalgia, that is muscle pain, and along with that you may have some bleeding tendencies. For example, you may have some spots over your skin. It is called as rashes or ecchymosis, and when we do investigations we find that the platelet count also decreases and other parameters such as coagulation parameters also gets dearranged. Sometimes even other organ failure can also involve in dengue fever. For example, the kidneys are involved. It can be in the form of kidney failure or acute kidney injury, and it can sometimes have transaminitis or liver injuries, and sometimes there can also be hematological complications such as bleeding tendencies, for example thrombocytopenia. Now, once a patient comes to the OP, at least 5 to 10% cases you can find it as dengue like illness or dengue fever. There are certain 5 to 20% patients who come even as complications of dengue fever. For example, they come as dengue hemorrhagic fever or dengue shock syndrome. Now, how do you investigate and how do you find out the diagnosis? We know that there are 4 serotypes of dengue virus, of which we see right now in Kerala is the DENV2 serotype. We have 4 serotypes: DENV1, 2, 3, 4, and DNV2 is now the most common serotype of dengue fever infections. Now, how do we investigate? We do the dengue card test or the IgM ELISA test. Then we do a normal blood count where we look for the hemoglobin levels, the PCV levels, we look for the platelet counts. Along with that, we do the liver function test and renal function test to look for organ failure damage, and we have to do a baseline chest x-ray to look for a capillary leak syndrome as well as an ultrasound abdomen to look for other bleeding manifestations. Once we get a diagnosis, we have to divide these dengue cases into mild, moderate and severe. So severe patients may require ICU treatment, but mild patients may require treatment on OP as well as IP basis. So OP basis can be managed if the patients are followed up from their houses, or they can show it in the OP basis. And IP patients, that is patients who have low platelet counts and who are very dehydrated with other manifestations like other organ damage, needs to be treated on IP basis. Now, is there any treatment for dengue fever? No. Basically, it is a viral fever and you do not give any antibiotics unless and until there are some complications. So for example, gram-negative infections, you start antibiotics for dengue fever unless it is complicated. So what is the treatment? We have to hydrate the patient. We have to give them lot of fluids. We have to tell them to drink lot of water. If possible, they are not able to have water, they will have to be given IV fluids, and you will have to give supportive treatment and monitor the counts daily. The counts especially being the hemoglobin, the PCV, packed cell volume and the platelet count. And once the platelet count starts getting improved, the patients can be discharged from the hospitals. So very important about dengue fever is supportive treatment, and if patients come into complications such as dengue hemorrhagic fever or dengue shock syndrome, we need to carefully monitor the patients and maybe admit the patients in ICU. There are certain deaths happened in Kerala, especially in Ernakulam city itself, where we have seen deaths of dengue patients because they go into dengue shock syndrome and other organ complications. So as a layman or as doctors, what we have to tell the public is we have to make sure that near our houses there should not be any stagnant waters. We have to clean our nearby areas, and we should make sure that mosquitoes don't breed near our houses. So be careful. Everyone needs to be careful with the dengue fever, as there are many cases of dengue fever coming out in the season. Thank you so much for your time.